Good afternoon. This is Dr. Elain Tong, and I have with me Paco with us today. Welcome to our YouTube channel, our show.
Thank you, Dr. Elain.
Paco is actually one of our toughest cases to date. I'm going to let you talk a little bit about what you've been through before you came to see us 6 months ago. Okay,
sure. Well, prior to 6 months ago, I had an amputation of right toe from diabetes. I had an infection. And then after that, I ended up having, I think it's edema, where my legs were leaking water from the knee down. I had a lot of water coming out. I had non-stop liquid. I was getting it all over the house, and my wife was complaining, and I was just getting water everywhere. It was like a water faucet turned on, you know.
From both of your legs, right?
Both my legs, yeah. And then I had infections happen. So that got pretty severe, and then I had to go to the hospital. And in the hospital, I found out that they helped my legs stop leaking, but I still had the swelling. My legs were very, very swollen, double the size than they are now, especially around my thigh area, and my knees were knees down were very swollen. My feet were swollen.
And not only that, actually from your knees down, from the knee to the ankle, the skin was actually rotting. Is that right?
Yes, the skin was rotting. It was, I had pus all over the place, and it was rotting, and I had the stink everywhere I went. I had the stink.
It was not a pretty picture.
No, it was not a pretty picture at all. It was, as a matter of fact, it felt horrible. It was horrible. It was a horrible experience, and so then I had to go back in the hospital, and I had what they call my lungs filled up with water. I couldn't breathe. I wasn't breathing. It was very, very scary to me because I couldn't breathe, and that was scary. And
so they diagnosed you with congestive heart failure?
Yeah, they diagnosed me with congestive heart failure. And also, too, I want to mention I've been on antibiotics since 2007.
For your legs?
For my legs and for the infections that I had and everything, you know.
So from 2007 till 2009, for 2 years, you were on and off antibiotics.
Yeah.
And did it ever clear your legs?
It would clear my legs, but then it would keep coming back.
Okay.
You know, so it was just like a temporary solution.
And they wrapped your legs too at that time?
Yeah, they would wrap my legs, you know, and my legs were being wrapped that whole time, and I get home care. They'd come and they'd wrap my legs, and I keep getting infections, and so I couldn't breathe. And then I came out of the hospital. My breathing was still very, very difficult to breathe, and I had this severe pressure on my chest right here. That my understanding is that when you have that pressure all the time, it's going to lead to a heart attack. And so it just felt like somebody was standing on my chest all times.
So you also had high blood pressure?
Oh, and I had hypertension. I had high blood pressure.
And how many medications were you on when you came to see us?
I think I was on 3 or 4 different medications.
Up to 5, I remember.
5, yeah. I think it was more.
At least 4.
Yeah, it was 4 or 5, and I think it was more towards 5. And
was it helping your blood pressure?
No, I got to be honest about it. That medication was making me very, very sick. I was just very, very. As a matter of fact, I almost fainted in the hospital, and they had to help me, but they kept me on the medication, and.
And you were telling me about your primary care doctor at the time. You told her, or him, I don't know. About
yes, I was telling my primary care doctor, and she told me to just keep taking it. That the side effects were not that bad. You know, she told me to keep taking them. But the thing is that I felt so sick I couldn't walk because I was passing out, and I had to have help just to walk. I was getting so dizzy, and. So I'm grateful because I happened to look. I went into a health food store one day, and I opened up a magazine. I seen an ad for Dr. Tong and his daughter, Dr. Elain, and I said, well, I'm going to give him a call and give it a shot. And you know what? It's one of the best things I've ever done in my life.
This was about 6 months ago.
About 6 months ago, because now it's like I feel like I have a new life. I have I feel like I've been born again. I feel like I felt this shift happen in my body, and I feel like I literally have life energy in me coming back to life.
Yeah.
And the pressure in my chest is like 99% gone. I still have a little bit, but I'll take this much compared to what I had before. And my breathing is much better. I can sleep good again. That's another thing, I couldn't sleep before.
Blood pressure, how's the
My blood pressure is fine, and don't ask me what my reading is because I never remember.
Well,
but it's good. I checked it yesterday, day before yesterday, and it's fine.
and not only that, you're on less medication now.
I'm on less medication.
Right.
As a matter of fact, I'm almost down to 0. And it's like...
And your blood sugar, how's your blood sugar?
My blood sugar is awesome. I don't even take insulin anymore.
Right, you don't even need insulin.
I don't need insulin.
Right.
I'm the kind of person that my sugar was regularly on a daily basis was up around 300 or 400 every day.
And now it's, you wake up as around
I wake up in the
100.
morning and I check it. It's sometimes it's 100, sometimes it's 110. The highest it goes is 120.
Okay, so a couple things I want to say. First of all, this is not one treatment and then he's like this. Paco is definitely a working progress, but some of the amazing improvements we've seen in him after receiving treatments from us and putting him on the Chinese herbs and the homeopathic remedies in combination with the treatment. He also went to get his legs wrapped again, and this time the wrapping is working. And not only that, you haven't been put on any antibiotics, right, for the legs. We did it one time, it didn't do anything.
No.
And not only that, like we said, he's off the insulin now. Because we had you on a homeopathic for that.
Right.
For the high blood pressure, I think you're on maybe one medication and then a Lasix for the...
I haven't even been taking that. The homeopathic I'm taking only.
Yeah, I mean, I don't even really... everything is doing much better. It's amazing, this transformation. And not to discredit the Western medicine, because the hospital bed was very important. For 2 years prior to coming to see us, you didn't sleep lying down.
No, I was sitting up, sleeping.
So that was an important point, and the wrapping helps in combination with the treatment. So this is a really amazing story. Less medication, almost no medication, feeling better than ever. There was a point where you almost had to go to the hospital after catching a cold, right?
Yeah, I got a cold and I got really sick. That was very close, and Dr. Tong treated me with the shots, and you know what? I didn't take no flu shot or anything. It just
we prevented that hospitalization. And then you had also a bout with exacerbation with sciatic pain a few months back.
Oh yes, that's another one too. Sciatic pain was very severe. That was that was horrible. And you know what? Today it's completely gone. I feel nothing.
Well, you were walking with the walker. You had to use a walker. You were back on a walker.
It was worse than that. I was on a wheelchair.
Right. Oh, right. Wheelchair.
Wheelchair.
And then we got you back on the walker, and now you're kind of use the cane once in a while, right?
Yeah. Now I can actually walk without my cane, which is, I think, fantastic.
Amazing. And you're able to drive.
Able to drive. Yeah, I couldn't drive, and I'm driving.
Yeah.
Even my eye is improving. I went blind from my right eye, and even that's improving. I'm getting my eyesight back in my right eye.
One thing I want to mention about the sciatica, because I think you were hospitalized for that, right? You went to the hospital.
Yes.
He went to the emergency room from a severe exacerbation of sciatic pain. And, you know, the doctors were telling me, well, that's the least of your worries.
Right.
But everything is connected. They don't realize that the sciatic pain, the channel that runs through the sciatica is the kidney and the bladder. Well, the bladder specifically, but the bladder is connected with the kidney. So Paco's kidney energy was very low, and that's why when it's low you get the symptoms that are connected with whatever the kidney controls, whether it's back pain or sciatica.